Hello everyone, this is Dr. Abdul Mutalib Khan and I'm an MBBS graduate from India and currently pursuing towards diploma in dermatology. My current focus is to transform healthcare by integrating traditional health wisdoms with modern practices and new approach to healthcare. eMedicard, an integrated holistic platform. But why? Do we really need an integrated health platform like eMedicard? Let's try to understand if we really require something like this. It all started with my own health story. In 2020, I got severe heart attack whilst crossing the road in East London. As during those days, I was going through lots of stress and pains which were continuously being thrown out towards me by my ex and catapulted due to lack of police support as I was quite new in this country. Then professionally it was very challenging days as mentoring my friend to establish his domiciliary care business in East London. Stress of personal life challenges and professional work commitments were the inducing factors for my heart attack. When I was crossing the road one afternoon in February 2020, I was lucky enough to be found by Jane and Teresa. Both of them are nurses from Royal London Hospital. And they just joined a day before. Thank God. They saw me struggling and picked me up from the roads while during the heart attack and took me to a Royal London Hospital where I was stabilized immediately. And afterwards, I was shifted to St. Bar's Hospital in St. Paul's in London. The cardiac surgeons decided to implant 2 stents and later suggested for an ICD implant in few months' time after my cardiac situation gets stabilized. But then my sister from US, who was doing research on holistic health care, suggested me to add few natural supplements. I have added and religiously committed myself to these supplements. And the result is that today I'm able to do 50 plus Surya Namaskars and 50 plus push-ups every morning in each set, and I do many sets of that. How did I achieve all this? Not only this, today I'm only on 1 medication from 9 medications, 9 prescribed medicines. How can I achieve remarkable progress when almost 70% of my heart was affected due to the attack? It's simply impossible, isn't it? But with holistic approach, it's not impossible as I stand as an example for all those who doubt alternative approach. My focus was not the disease that was well taken care by the specialists thanks to doctors and NHS, but my focus was to regaining my holistic health back. As our bodies have a remarkable ability to heal, I started to dive deep into implementing best food practices into my life. So I hooked to Mediterranean diet. Then on suggestion of my sister, I added ajwa dates and its seeds powder, and my mom forced me to garlic and black seeds on daily basis. So I started to notice improvements, and within a year, I started to wean off myself from powerful cardiac functioning altering drugs, which were troubling me with side effects like sweaty palms and cold feet and sometimes nausea and all that. And I could feel overall improved. I started to feel much better without pharmaceutical drugs. And my physical activities like Surya Namaskar and push-ups can be performed very easily. As a medical doctor and with a focus on evidence-based solutions, I started to do research on the microingredients and nutrients of natural supplements I was consuming on daily basis. I was amazed when deep dive into finding natural compositions of these miraculous supplements. And these are present since the origin of humans, isn't it? I found them as a powerhouse of health nutrition like potassium, magnesium, and healthy fats, which helped me in lowering the cholesterol and improve overall blood flow. I mentioned these in more detail on my website, that's www.emedicard.co.uk. With me as an example and knowing that our bodies have a remarkable ability to regenerate, I started to research on connection of food and its regenerating abilities. As a medical doctor, my interest began towards healing diseases naturally through dietary interventions. Then I was introduced to an ocean of natural healings by friends from Harvard and institutes of integrative medicines. As a doctor, my first interest was towards diabetes, which is the number 1 killer, isn't it? I was suggested to follow work of Dr. Jason Fungs, who is an author of books like Diabetes Code and Obesity Code. I was amazed and saddened both when I realized that in spite of using common sense and a bit of research and evidence, we doctors unfortunately got influenced by fat and powerful pharmaceutical version of diabetes. I'm sorry to all the viewers. As a doctor, we have failed you because we got tampered and confused between cure and treatment. We started to believe blindly the version of stories presented to us by pharma industry. Diabetes, which is caused due to diet, should be addressed only through diet interventions to achieve complete remission. Yes, I mean to say complete remission, that is complete cure. Type 2 diabetes doesn't need medication at all, isn't it? All it needs is few interventions and steps to give you a complete cure. You can find video on how to cure diabetes and mild to moderate depressions and autoimmune disorders on my YouTube channel. As my understanding has now become more clearer after my own heart recovery journey and coming across works of MDs from Harvard and Institutes of Integrative Nutrition across the world, I decided to create a platform like eMedicard to help many others and provide natural solutions wherever possible that are both effective and sustainable. By combining the best of both the worlds, I aim to improve the health and well-being of individuals who are suffering from chronic illnesses. Because as a believer, strongly agree that God has created cure before he has sent down the disease. So every disease has a cure. Join me on the journey to explore a new approach to cure diseases like diabetes, mild to moderate depression, coronary heart diseases, autoimmune disorders, cancers, etc. only through natural interventions or safe and evidence-based alternative medicines with very few or negligible risk of modern medicine. Together, we can make a difference. All we need is to change the mindsets of our doctors and the practice by creating associations with holistic health platform like eMedicard, whose philosophy is based on cure and holistic approach rather than molecules and chemicals. From healthcare to health creation, by including holistic health roadmaps as a functional framework. I like to say a famous quote here: let food be thy medicine and medicine be thy food. This quote from the father of modern medicine underscores the foundational belief that proper nutrition can play a significant role in healing and preventing diseases, both. And I remember another quote from Thomas Edison: the doctor of the future will give no medicine but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. So let us embrace holistic thinking to achieve meaningful outcomes in all the aspects of healthcare. That is shifting focus from treatment to cure, from disease to a person as a whole, from supplements to healthy food choices, from disease control mindsets of doctors and patients to disease cure approach. I'm not against medicines. How can I be when myself is a doctor and these medications itself help me survive during acute myocardial infarction? I mean to say acute, but I'm against chronic medications wherever possible. These chronic medications have already burdened human systems and systems like NHS, whose tireless efforts to provide best healthcare services to all is hijacked by big and fat pharma industry, who made NHS a scapegoat. Why we as doctors can't cure when we can? Why we should prescribe chronic medications and painkiller when not needed at all? Why follow the science and try to invest a wheel which hooks a person to chronic suffering when you have a new concrete data of natural healings? So with that thought, I leave you with my slogan: save lives, save NHS.